Scientists just cured an incurable brain disease for the first time in history, and it's changing everything we know about genetics. Huntington's disease has been a death sentence for families for generations. If your parent has it, you have a 50% chance of developing the devastating condition that kills brain cells and leads to dementia and paralysis. But today, researchers announced they've successfully treated Huntington's with gene therapy, slowing disease progression by 75% after 3 years. The treatment involves a 12 to 20-hour brain surgery where a modified virus delivers DNA that blocks the toxic protein causing the disease. This isn't just about Huntington's. It's proof that we can rewrite our genetic destiny. Families who've watched loved ones deteriorate are crying tears of joy because the first domino has fallen in the war against inherited brain diseases. We're witnessing medical history.
Yale scientists are asking if magic mushrooms are a mental health breakthrough or just magical thinking. And the answer is complicated. Psilocybin research is exploding as states rush to legalize psychedelics for therapy. But psychiatrist Benjamin Kelmendi warns we need to separate hype from science. Early studies show promise for depression and PTSD, but we're still learning how these substances actually work in the brain. The magic isn't in the mushrooms themselves. It's in how they temporarily dissolve the brain's default mode network, allowing new neural connections to form. But Kelmendi emphasizes that psilocybin isn't a miracle cure. It requires careful preparation, professional guidance, and integration therapy to be effective. The real breakthrough isn't the drug. It's understanding that consciousness can be therapeutically altered to heal trauma and depression in ways traditional medications can't touch. Youth happiness has completely collapsed, and today's teens are carrying unprecedented fragility into adulthood. New research reveals that the traditional U-curve of happiness, where life satisfaction dips in middle age, then rises, no longer applies to the current generation. Unlike previous generations who found resilience through adversity, today's teens face a perfect storm of social media comparison, academic pressure, and global uncertainty without developing coping mechanisms. The collapse isn't just about being sad. It's about lacking the psychological tools to bounce back from setbacks. Researchers warn that without new resilience training, we're creating a generation of adults who crumble under normal life stress. This isn't about coddling kids. It's about recognizing that the modern world requires different mental health skills than previous generations needed, and we're failing to teach them.
Scientists just discovered how dopamine controls movement, and it's revolutionizing our understanding of motivation. New research reveals that dopamine doesn't just make you feel good, it literally changes the electrical activity of neurons in your brain's motor circuits to promote action. This breakthrough explains why people with depression struggle to move and why ADHD medications help with both focus and physical activity. The study shows that dopamine acts like a volume knob for your brain's movement system, turning up the signal when you need to act and turning it down when you need to rest. This discovery is huge for treating Parkinson's disease, depression, and ADHD because it proves these aren't separate conditions, they're all connected through the same dopamine movement pathway. Understanding this mechanism could lead to better treatments that target the root cause of motivation problems rather than just masking symptoms.
Emma Hemming Willis just revealed the brutal reality of watching Bruce Willis battle dementia, and her honesty is changing how we talk about brain disease. In a raw interview, she described the peaks and plateaus of frontotemporal dementia, explaining how some days feel almost normal while others are devastating. Emma's decision to go public about Bruce's diagnosis wasn't just about awareness, it was about survival, giving their family permission to grieve while he's still alive. She's becoming the face of a new kind of caregiving that prioritizes the caregiver's mental health alongside the patient's needs. The interview reveals how dementia doesn't just steal the patient, it transforms entire families, forcing them to find new ways to connect and love. Emma's vulnerability is revolutionary because it shows that caring for someone with dementia requires caring for yourself first, something society has never taught us.
Tylenol works through your brain's marijuana system, and this discovery is changing autism treatment. New research reveals that acetaminophen doesn't just block pain signals, it activates the same endocannabinoid system that cannabis targets, explaining why it helps with both physical and emotional pain. The breakthrough shows that Tylenol can reduce social anxiety and improve communication in people with autism by calming overactive brain circuits. This isn't about getting high, it's about understanding that pain and social connection use the same neural pathways. The discovery explains why some people with autism feel better after taking acetaminophen, and why cannabis-based treatments show promise for sensory processing disorders. Scientists are now exploring how this everyday painkiller could be repurposed as a social anxiety treatment, proving that sometimes the most revolutionary discoveries are hiding in our medicine cabinets.
Macaws are teaching us the origins of social learning, and it's rewriting human psychology. Scientists studying these colorful birds found them swaying to pop songs and engaging in synchronized dances that feel delightfully human rather than just instinctual. The research reveals that social learning, copying others to fit in, isn't uniquely human, but evolved millions of years ago as a survival mechanism. Macaws learn dance moves from each other the same way humans learn TikTok trends, suggesting that our need to go viral is actually an ancient biological drive. This discovery explains why social media is so addictive. We're not just seeking attention, we're following evolutionary programming that helped our ancestors survive by staying connected to the group. Understanding this bird behavior is helping scientists decode why humans are so susceptible to peer pressure and social influence, proving that going viral isn't a modern phenomenon, but an ancient survival strategy.
Therapy just got a major upgrade, and it's all about getting specific with your words. New research shows that when patients shift from vague emotional labels to vivid, detailed descriptions, something powerful happens. They actually feel better faster. Instead of saying you're anxious, describing the tight chest, racing thoughts, and sweaty palms activates different brain regions that promote healing. The breakthrough reveals that specificity isn't just about communication, it's about rewiring your neural networks to process emotions more effectively. Therapists are now training to ask more detailed questions, moving beyond how do you feel to what exactly does that feeling look like, sound like, and move like in your body. This isn't just better therapy, it's precision medicine for mental health, where the exact words you use become the treatment itself. The research proves that language doesn't just describe our inner world, it literally shapes our brain's ability to heal.
The doctor who trained Nazi physicians helped create modern psychiatry, and this dark history is finally being exposed. Emil Kraepelin, whose work shaped the DSM diagnostic manual we still use today, provided the scientific framework that Nazi doctors used to justify their atrocities. His classification system for mental illness became the blueprint for deciding who was fit to live and who should be eliminated. This isn't ancient history. Kraepelin's influence still permeates how we diagnose and treat mental health conditions today. The revelation is forcing psychiatry to confront how diagnostic categories can be weaponized and how scientific objectivity can mask dangerous biases. Understanding this history isn't about canceling psychiatry. It's about recognizing how power structures shape what we consider normal versus pathological. The field is now grappling with how to honor scientific progress while acknowledging the harm done in the name of mental health treatment.
Your brain uses quality shortcuts that can be easily faked, and it's changing how we judge everything. New research on heuristics reveals that we rely on mental shortcuts to evaluate restaurants, products, and even people. But these shortcuts are increasingly being gamed by marketers and influencers. The study shows that our brains look for signals like reviews, social proof, and authority figures to make quick decisions. But these signals can be manufactured through bots, fake testimonials, and paid endorsements. This creates a psychological arms race where authentic quality competes with artificial signals designed to trick our mental shortcuts. The research explains why we feel overwhelmed by choices and why fake reviews feel so convincing. They're exploiting evolutionary shortcuts that helped our ancestors survive, but leave us vulnerable to manipulation. Understanding these heuristics isn't about becoming paranoid. It's about developing better mental filters for an age where authenticity and artificiality are increasingly hard to distinguish.